Sister Science Facts.
And today, we are going to be unpacking a piece of legislation that has a really flashy name, but quite serious stakes. You may have heard of it.
The One Big Beautiful Bill Act.
I mean, what is that?
It's like the most Trump title ever possible. We're going to do this all in one bill, and it's going to be beautiful. It's going to be one big, beautiful act.
One big, beautiful bill.
In fact, here's him saying exactly that. You ready for this?
I don't think I am.
Thank you all for being here to support one of the most important pieces of legislation in the history of our country. And when we were thinking about doing it, we were going to break it down into 3, 4, 5, 6, or even 7 bills. And I said, let's make it one big, beautiful bill, Mike, right? They actually said it would be very much harder to get this way, but it would be better. And the truth is, I think it worked out well because there's something for everybody.
Okay, so this big, beautiful bill is being pitched as a comprehensive fix for the economy, and I mean everything else in America. Underneath that surface, it is actually a blueprint for some of the most sweeping changes to healthcare since the Affordable Care Act.
And spoiler, in the fine print, it might not be all that beautiful.
Unfortunately. So while this is a massive bill that is going to affect everything from taxes to defense, clean energy, education, food stamps, today we are going to specifically focus on healthcare because tucked into this bill are changes that are going to reshape how millions of people access healthcare in this country. And that is especially true for families with young children, families that have low income, and for families that are navigating any type of disability.
So one of the true things that Trump said is that this could be 3, 4, 5, 6, maybe even 7 separate bills.
But like vaccines, we're going to focus on the number. Just get the number as small as possible, and then it's better. I don't know.
It's better, and then it's better. It's better. It's better.
It's just too many bills.
It's better. So there's a lot in here about healthcare. And the first big section that this bill tackles is Medicaid.
Medicaid is a public health insurance policy that covers
70 million Americans.
70 million Americans and more than half of children in the U.S.
through Medicaid or CHIP, which is the Children's Health Insurance Program, which is kind of housed in that same branch.
So in this big, beautiful bill, there are a lot of changes to Medicaid that are being proposed.
The first is proposing a transition of Medicaid funding to block grants. Now, we've talked about block grants before.
And the important thing to know here is that a block grant would give a set amount of money to each state to help fund Medicaid, no matter how many people need care. So there would just be a set amount of money, and that's what it is. Even if more people need care and you don't have enough money, it's a set block grant. There is no variability there.
Currently, there's kind of a more open-ended match system where the federal government covers a percentage of each state's actual Medicaid spending, and there's no cap. So if you spend X amount, the government will match X amount. With block grants, the federal funding will be capped regardless of the actual need or actual cost in a state.
So you can imagine that that would lead to some downstream impacts on how many people are able to be covered by Medicaid or what services Medicaid might be able to provide.
This has been something that Republicans have been seeking for a long time. They have reintroduced block grants to Congress many times. And the reason why this is really appealing to some of the Republican members is that it typically gives states more control over how Medicaid funding is used.
Another change that this bill is seeking is to introduce work requirements for people who are on Medicaid. And this includes for people who are parents caring for small children.
We have also talked about this before.
It is popular among Republican lawmakers to focus this idea that there are people on Medicaid who are sitting on the couch and not working and benefiting from public insurance. That is not the reality. That is the myth. Most people who are on Medicaid are either already working, disabled and unable to work, or they're unable to be in the workplace because they're caring for children.
According to 2023 of the Kaiser Family Foundation, which is a research organization that does a lot of Medicaid statistics, They found that 92% of adult Medicaid enrollees are either working or exempt from work requirements. So this is really affecting a very small portion of Medicaid enrollees.
And yet, so much of the conversation.
Such a huge focus.